Hello, and welcome to my one on one ultrasound in emergency medicine teaching. My name is Dr. Fahad Butt, and I'm a consultant in emergency medicine. Today, I'll be walking you through the key echocardiographic findings in pulmonary embolism. Echo doesn't diagnose the PE itself, but it tells you how sick the patient is and how urgently you need to act. The first view that you are about to see is parasternal long axis view. Take note of the left ventricle. In significant pulmonary embolism, the left ventricle often appears small and underfilled because the right ventricle is failing to pump blood forward. This can help you distinguish pulmonary embolism from cardiogenic shock, where the left ventricle is usually dilated or poorly contracted. The second view you are seeing on the screen is apical four-chamber view. When you open the apical four-chamber view, compare the right ventricle to the left. If the right ventricle is larger than the left ventricle, or the right ventricle left ventricle ratio is above 1, you are seeing early evidence of strain. Acute right ventricular dilatation is one of the strongest clues pointing towards a significant clot burden. Also, you're going to look at the right ventricular contractility. In acute pulmonary embolism, the mid-right ventricle free wall is hypokinetic, while the apex continues to contract well. This pattern is called McConnell's sign. The third view you're going to see is parasternal short axis view. If the left ventricle looks D-shaped, the septum has flattened because right ventricle pressure is high. Flattening in systole indicates pressure overload, which is typical in acute pulmonary embolism. Again, note the large size of the right ventricle on parasternal short axis view, and the D-shaped left ventricle is very obvious. Occasionally, you may directly visualize a mobile thrombus in the right atrium or ventricle. This is a clot in transit, and it's a time critical finding. These patients are at high risk of sudden collapse and usually need urgent thrombolysis or embolectomy. In the end, to summarize, the main echo findings in pulmonary embolism are right ventricular dilatation, right ventricular dysfunction, including McConnell's sign, septal flattening with a D-shaped left ventricle, clot in transit, and a small underfilled left ventricle. Echo cannot replace CT, but in unstable patients, it gives you immediate insight into the severity and guides you management.
Thank you for listening and stay tuned for more.